My dear friends, I'm going to speak with you about something which is very near and dear to me, on which I've been working for the last 35 years, out of which 19 years I have spent in stitchless spine surgery under local anesthesia. This surgery, when I started in 1999, has given me a very, very different perspective on what we should do, what we have been doing, and how we need to change it. Unfortunately, in the realm of spine surgery, where there are multitude patients who are suffering with back pain, sciatica, and claudication, there are few areas which have been neglected, ignored, and have been not even taught in our medical school education. One of those is how to diagnose back pain, sciatica, and claudication to manage the patient with the required treatment, with the required solution. The problem is, as surgeons, we are taught how to choose a patient for surgery rather than diagnose the problem of the patient and pay attention to the realities of life, where the activities of daily life of the patient may be affected, and the patient may not be able to carry on with the activities and may not be able to have a good quality of life. When the patient starts suffering and starts getting pain, which is so bad that he cannot stand, walk, sit, or lie down, or cannot work, or cannot really concentrate on anything meaningful, the patient normally seeks an opinion from a clinician. And what has been happening over the last several years is, on the doctor's side, we are increasingly short of time. We increasingly are guided by images and by reports, and that basic interaction between two human beings where one is suffering, that sufferer's brain has already diagnosed the problem, localized the problem, but the patient is not able, or the sufferer is not able to narrate the issue in medical language. So he or she takes help of Google nowadays and tries to enunciate some description which may fit into a very logical way of explanation for the doctor. The doctor, on the other hand, is unable to diagnose because he doesn't know how to diagnose, and would like to concentrate on the images, would like to concentrate on the various reports and try to come to some conclusion in his or her mind as to what is this patient suffering from. In fact, we say that a fundamental question which we have in front of us, which we need to answer very clearly, is where is the pain coming from and why is it not going away? Now, this is a very simple question, but has not been answered very clearly till we people started doing surgeries under local anesthesia. For one, I started stitchless surgery under local anesthesia in 1999, and then a whole new world opened up where the patient's suffering, the pathology or the etiopathology of that suffering, the imaging impression of that etiopathology, the symptoms of the patient, etc., all of that was correlated very well for the first time, because we were operating the patient under local anesthesia when the patient was awake and aware, and I was able to put a scope through the intervertebral foramen in the spine, look at the pathology which was causing the pain, and sort of confirm with the patient, ask him, is this the pain which you have? And the patient would then report in positive, saying that yes, that is what I am suffering from. And then we used to offer a solution which was much more precise, much more safe, and very, very enabling, satisfying to the patient, at the same time being very innovative. So that prompted us, that prompted me to come out with this idea of talking with you and making you aware of how do we diagnose precisely the pain in the back and the pain in the leg and the claudication which the patient suffers from.